Hi, everyone. I can't really see anything other than my screen right now. So uh, please send a chat if you feel like you're not seeing what I'm seeing on my screen. Um, but welcome. I'm just going to go ahead and get started with today's workshop. So this is the last of the Research Synthesis for Evidence-Based Health Policy workshop series. Today's workshop 3, Synthesis in Service of Health Equity. If you are not able to make it to the first 2 sessions, no worries at all. We are happy to have you. And you'll be able to get recordings to the first 2 workshops if you want to learn more after the conclusion of this. So I'm one of 3 presenters for today's session. My name is Amy Corder, and I'm a research support librarian at the Mattis Library of the Health Sciences. My colleague Laura Wright, the Mattis Library's coordinator of research services, we're both from Tulane University. She's teaching today as well. Christopher Stoyanovsky can't join the meeting today, but he's still presenting because he pre-recorded a couple of slides so that we can share some information to bring in a health policy and public health perspective that that you might find helpful. And he's a research assistant professor at Tulane University's School of Public Health and Tropical Medicine. So we just wanted to share a bit about what to expect from today's workshop. So today's session will be 75 minutes, but the content will be a bit shorter than that. We're just trying to keep a lot of time at the end for Q&A. So we'll be starting with a review of the homework from the last session, just kind of talking about the last session a little bit. And there will be one active learning exercise with breakout rooms. So today's workshop will be about data extraction and synthesizing all of the research data that will be included on an evidence synthesis project. So you can feel free to ask questions throughout in the chat, but we also have a Padlet for the workshop series, which we'll be sharing the link in the chat in just a moment. And I'm going to share the Padlet on the screen so you can see what I'm talking about. Okay, so I hope you all can see my screen right now. I'm just going to copy and paste the Padlet link. So these are questions from the whole workshop series. And if you have questions, you can put them in the chat or you can put them in this Padlet, and the Padlet, the name isn't next to the question, if that matters to you. But if you want to add questions to the Padlet, you can go to the link, and then at the bottom there's a little plus sign, and you can type in your question here, and then you can click the publish button and you can change the color of it or whatever you'd like to do. That's just how it works. So I'm going to go back to the slides really quickly. And okay, so I just quickly wanted to review the main takeaways of workshop 2. And that was all about finding the information for an evidence synthesis and kind of getting started with sorting through that information. So we recommended that when searching for articles, you want to document everything. So using 2 or more scholarly databases, combine subject headings from those databases with synonyms in the title, abstract, or text word fields. And you can watch the last workshop for more information about that. And we recommend keeping a file to document your searches. Journals will usually ask for this information because without a documented search, your research is not reproducible. And the goal is to be exhaustive and find all studies that would meet your eligibility criteria. So we also discuss the steps involved in article screening, and Laura will be demonstrating one tool that can make the step run more smoothly in a couple of slides. We also discussed inclusion-exclusion criteria in more detail and how it's referenced when screening articles. The reason I'm reviewing these takeaways is just as a refresher as to what leads to this point in the evidence synthesis process. Today we're talking about synthesis of data, and this review is a quick reminder of where that data comes from in the first place. And just reviewing what we asked you to do for homework after the last workshop. If you weren't in the last workshop, that's okay. We just wanted to share this for your reference, and we'll be able to send the slides afterwards. One video is a Rayanne tutorial, which Laura will be demonstrating in just a moment. And we also included a YouTube video about a data extraction with the tool called SRDR. But we will be going into that today with no fancy software required, but we wanted you to be familiar with how it might work using an evidence synthesis software for familiarity. So that's why we provided that video. We also linked a data extraction libguide from George Washington University because it's a great resource with a short overview of what data extraction means and what tools are available, as well as a bonus citation management library guide page from Tulane to learn more about an open source citation manager called Zotero. Additionally, if you're working on an evidence synthesis yourself or preparing to do, Workshop 2 had all of the information you need to run the searches and screen all of those articles for inclusion or exclusion. So just wanted to review that homework really quickly. And I'm going to pass it over to Laura, who's going to share a bit about Rayanne and show a little demo so you can see what the software looks like.
Okay, this is the Rayon website. It's a .ai, not the .com or .edu. AI is all the rage now, so it should be fairly easy to remember, but we will have it in the slide notes as well. I'm going to go ahead and sign in, but before I do that, I do just want to show you that there are different options here. There is a free option for using Rayon, which I think is wonderful. You can have 3 active reviews at a time, and you can invite a bunch of people to use this product with you. If you do want to have more options for this, you can use the professional version. I don't know how they check for the student version. It probably would be an email address, but it's not too much more. Just if you have an option to have someone pay for you to do this, might as well. You get a few extra options. But I'm going to go ahead and I'm going to sign into my account. Okay, so what we have here is I have one review that I'm currently working on relating to this webinar series. There are some other reviews that you can take a look at. They're public reviews, so you can kind of see what other people are working on. But we'll go back to my reviews. And this is just kind of showing you the basic data I have at the moment. So I'll go ahead and show you what it looks like. Okay, so over here in the middle to right-hand side of the screen, we have the information for the articles. We have our title, we have our authors. I'm going to come down to one that I haven't worked on yet. What we're having pop up is going to be the title of the article as well as the abstract. So you remember we were doing in that title and that abstract review. Over here, we have our inclusion decisions. So undecided are ones that we haven't worked on yet. Ones that are maybe or ones that are marked maybe. Ones that we want to include are here in included, and ones that we want to exclude are in excluded. So we have our options here. I'm going to go ahead and pretend that I've read this, and this is not something that's going to relate to our topic. It doesn't meet all of our inclusion criteria. So I'm going to go ahead and exclude it. And it's going to pop up showing that I have excluded it. I don't really know why they're using red and green, especially in this day of age of where they're talking about accessibility for color blindness. But that's what they use to indicate whether you're including or excluding things. And over here, you can take a look at which ones have been excluded and which ones have been included. So I guess that's a workaround if you do have that disability. We can go back to our undecided and we can continue through. Now, one thing is nice is you can actually add keywords for exclusion and keywords for inclusion, so you can kind of see like what is popping up. So we have our randomization, which is an include, things like that, RCT, which should be an include as well. So you can kind of see like what's going on here with all of the stuff you're working with. Let me go real fast into PubMed, because once again, PubMed is a freely available database, and you can use the references here from PubMed in RAN. So I'm going to go ahead and send these. I'll just do all results. I'm just going to save that. I'm going to go back into RAN. I'm going to start a new review. I'm going to call it tests just so we don't accidentally start working on it again. Empty biomedical. We're not going to put a description for sake of time. Okay. And I want to select those files I just downloaded from PubMed. And there we have all of those articles. So it's pretty easy to move things from the databases into RAN and have a interface that allows you to do that title and abstract screening without having to like make your own Excel spreadsheet or doing it in a Word document like we did the last time. So it's definitely something that I would recommend people take a look at just because it makes the process a little bit easier as you're going along. And why don't I go ahead real fast and see if I can sign out. I'll just go back to the main page. And I can drop the link here in the chat just so everyone does have the copy of it right now. And if you have any questions about Rayanne or the title and the abstract screening, feel free to go ahead and drop them either on the Padlet so we can go to them later, or drop them in the Q&A or the chat. You just give me 1 second, I will get the PowerPoint back up.
Okay, so I just quickly wanted to share that these are today's learning objectives. We're going to be doing data extraction and active learning. Along with that, we're going to be discussing quality assessment, and that kind of falls under the analysis umbrella. And then synthesizing data, and Christopher will be talking about writing for policy. So next slide. Okay, so sorry, my computer's not cooperating. Okay, so what do we mean by data extraction? Well, in a clinical research study, the data is found through searching for information. So without a high quality search, there may not be sufficient data to, I'm sorry, my computer just is not cooperating. Okay, sorry about that. Without a high quality search, there may not be sufficient data to extract. So I just wanted to point this out because planning and following the methodology is very important, because that will directly impact the data that you have. So you want to think of searching as data collection, screening as data cleaning, and data extraction as getting all of the important information out of each article. So at this stage, you will have determined which articles are to be included. And if you've used something like Rayanne, you will have read the full text of each of these, no matter what tool you decide to use. However, to extract the data, you'll read the final included articles again and collect only the most important data that relates to your research question, which should be outlined in your protocol. So while other data might be interesting to you and might be really cool, you really need to stick to the data points that you outlined at the beginning of your project and your protocol, which should in general relate to the research question and the most important characteristics of each study identified by your group. So the method you choose for collecting data, that can vary, and I'll be going more into detail about that on the next slide. But basically, you want to create a form or use an existing form template to extract the most important data points. So 2 people are recommended to complete this step independently once a data collection method and form has been developed, then the results can be reviewed for consistency across both reviewers. So having two people complete the step independently reduces bias at this stage of the process. The data extraction form, that would include, I mentioned this just a moment ago, but it would be any relevant information about each study. But that data you extract would depend on what the team finds most important, but it also, there might be information about participants, locations, numbers of participants included, or other data's details about each research study, maybe relating to study type. Okay, next slide. And just a moment ago, I mentioned data extraction tools. And one of those tools that can be used is the Systematic Review Data Repository, or SRDR, from the Agency for Healthcare Research and Quality. We included a tutorial video of that for the homework. It's free to use, but there are a lot of other free or paid options that you can look up, and we'll link the Systematic Review Toolbox website, which is on this slide. But some teams don't use any systematic review specific software. They might use spreadsheet software such as Excel, Google Sheets, to create forms and collect data. Some people use surveys or forms through Qualtrics, SurveyMonkey, Google Forms, or other similar products. And for today's active learning in a while, we will show you what the process looks like using paper or electronic documents. So what I mean by that is by using Microsoft Word, Google Docs, or another word processing program to create the data extraction form, and you fill it out for each included study, either digitally or by using paper and pencil. So you'll be able to get some hands-on experience with this soon during our active learning portion of the workshop. So it feels a little bit less abstract. You can kind of see what it is like in real life.
Okay, so now that we're pretending you've extracted your data, you want to make sure that the data is of good quality, aka it's not been manipulated, it's not made up, and or it's not junk. So you will want to do a quality assessment, which is also referred to as a risk of bias assessment or quality reporting. There are a lot of different tools that you can use to help determine the quality of the research you've found. And one of the easiest ways to identify a good one to use is to look to see what others in your area of interest have used already. That way you don't have to try to make your own scales or instruments or try to make your data work with a scale that's not really made for your type of data. There are scales, and we'll show you some on the next slide, that are made specifically for randomized controlled trials, which you probably won't often see when you're talking about a concept like health equity. But there are scales for observational studies, like cohort studies, case controls, and even case studies. So more of the kind of research you will most likely be working with. After you take a look at the quality of the data, you can use another predetermined scale to grade the data that you found. This is called grading criteria, and the most common one you will see is called GRADE in all capitals. It stands for Grading of Recommendations, Assessment, Development, and Evaluation, and they have 4 grades that you can assign to the quality of the data: high, moderate, low, and very low. There are explanatory documents per grade to help you determine the level of your data as well. The grade is good to know because you don't want to be making decisions based on poor data. And if people decide to use that data anyway, you want to be sure that it's documented that it's not good data. So when you're writing up your report, you can include information about how you conducted your quality assessment in your methods so that the audience is aware the quality assessment was performed and you are aware of how it was performed. And in your report, you can include a table showing the grade of your data to make it visually clear how good that data actually is. Okay, so here are some quality assessment tools you can use when you're working on your evidence synthesis. The Joanna Briggs Institute is a highly respected institution in the evidence synthesis world, and they have a variety of checklists that you can download to help determine the quality of your data. Sign is another place to get checklists to work through for quality assessment as well. A few that are not mentioned on the slides, but will be available in the speaker notes on this slide deck, are the National Heart, Blood, and Lung Institute Quality Assessment Checklists, which also includes notes to help complete the checklists, and the STROBE checklist, which stands for Strengthening the Reporting of Observational Studies in Epidemiology. We also have a link to information about the grade approach. You won't be able to forget the grade approach after this, so you can find out more information about how to grade the evidence after you assess the data. Also, you can find even more information in the Systematic Review Toolbox, a tool that is freely available and links out to resources to help with each stage of the evidence synthesis process. This is a great tool to take a look at and to add to your favorites in your browser. Okay, so we're going to go in some active learning about data extraction and quality assessment. We'll break everyone down into groups for breakout rooms, and we will provide you with a research article and a combined data extraction and quality assessment form from Cochrane. What you will do is pull the data from the research articles to see what information is actually available and assess the articles for quality. We don't have much time for this activity as we are limited by the time frame of the workshop sprints, but try your best to pull out information. The form is long, so don't worry about filling out everything. This activity is supposed to help you get an idea of what data extraction and quality assessment are actually like, not to have you know all of the data points about these articles. We have the links to the form and to the research articles in chat, so open those before you enter your breakout rooms. Okay, welcome back, everyone. Let's go ahead and move on to our next slide. Okay, just so for the sake of time, we're going to go ahead and continue on. And welcome back from the Data Extraction Quality Assessment Active Learning. I know we didn't give you nearly enough time to work through the articles or the worksheet. Data extraction does take time, and the generic worksheet you are working with isn't usually the form you'll actually be using to extract data. We will be sending out slides with the links to other data extraction and quality assessment forms, so be sure to take a look at those and see which ones work best for the types of information you're working with. The Cochrane one is very long and very detailed. A lot of them aren't that way. So now, after you've pulled out the data and assessed how good the information is, it's time to synthesize all of that information. Synthesis is pretty much describing your results the way you would whenever you're reviewing information and summarizing it either for yourself or others. This slide has information about two different types of syntheses. If you are working on a project and you have information that is sufficiently similar, like same study population, same intervention or actions taken, and similar result measures, then you can do what is called a meta-analysis. A meta-analysis is a quantitative type of synthesis where you take a lot of data, put it together, and get new results. It's like doing all of the studies yourself without having to do the studies. What you'll most likely be doing is a narrative or descriptive synthesis. This is where you have a variety of information, so different study populations, different interventions, different result measures. And instead of putting all of that information together, what you'll do is actually just describe the information you found. If you've written a research paper in the past, it's a pretty similar idea. You are telling people what you have found, not trying to come up with new information. Now, you may remember from workshop 1 when we were talking about writing protocols and we mentioned PRISMA. That stood for the Preferred Reporting Items for Systematic Reviews and Meta-Analyses. There's a great tool from PRISMA that is called a PRISMA flowchart, where you can report everything that you did up to this final point. All of the articles that you found, all of the articles that you screened, all of the articles that you're using in your final analysis. This is great to include when you're synthesizing the information because it will show your audience that you thoroughly examine the information that is available and you're making as unbiased of a report as you possibly can. On the next slide, we'll be hearing from Christopher for more information that is specific to synthesizing evidence for policy. But before that, I'm going to check the chat real fast.
Hey everyone. I'm sorry I can't be here with you all for the final session, but I'm on vacation this time around. But I did want to offer my insights on some of the pieces that we
Oops.
are talking about during this workshop series and some of the important things about synthesizing and writing evidence for policy. So, when we're synthesizing the science, we've done all this review, we've pulled all this data, extracted information. We really want to make sure that we're focusing our synthesis on the policy relevant questions. We don't need to synthesize everything for the policy or decision maker, but really what is it, the information that they need for them to be able to make a decision. And so in here, you want to really focus on that piece in terms of your synthesis. I'm not saying everything else is not important, but really you don't have a lot of space to engage in all the science with policymakers. I think another important piece to think about is if you can find expertise or get someone who can support you in conducting meta-analyses, this really does go a long way. And really what the meta-analyses are for is to measure the overall impact across the studies and examine, what is the significance of that. You might find this challenging given there might be different study designs, different populations. I mean, that makes that a bit more challenging to do these meta-analyses. But lawmakers or policy and decision makers really do enjoy those because they can see, oh, here's the estimate of the impact we can have if we create or draft or put this policy into practice. I think another important piece as you're synthesizing the evidence is really to bring in this economic argument. I've mentioned this before in the previous sessions. So if you can do cost effectiveness analyses, these are really helpful. Policymakers are really interested, thinking about if we're going to spend X dollars, what is the potential output or what can we expect to get for those monies that we're spending? And, another important piece to this, a lot of the anti-arguments is like, oh, it's too costly, it's too costly. Well, these are some of the things that you can start to guard against with bringing in this economic argument. What we also want to do is synthesize any findings that might be used against your specific recommendation to the policymaker. You really want to guard against these. And so if you are seeing in the literature, an anti-argument and the evidence isn't as strong, bring that in to your synthesis. And really, 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 really important is make it actionable. How can the policymaker, decision maker take what you've just synthesized and act upon it and put it into policy or practice? And also now I want to talk about writing for policy. So here we just synthesized everything and now we got to package it all and put it all together. One of the important things for writing for policy and decision makers is really to make this specific as possible. Include your arguments for the desired policy, put that specific ask into your writing. If you cannot lobby, we've talked about this before in the previous sessions, just exclude the specific legislation. Don't talk about the specific law or bill. Don't put the yes, I want you to vote this way or no, I don't want you to vote this way. Just leave that part out and you can still make your specific kind of request and push for that specific policy without actually talking about legislation. So what you want to incorporate in here is all of your arguments for your desired policy. So something like, based on all the scientific literature that we have synthesized, this is the way forward that we think you should move this policy or act upon. Again, I mentioned mitigating arguments against your policy, bring in those weaknesses, and really try to, while a policymaker is looking at your stuff, they're also at the same time getting information from so many other sources, right? Lobbyists, other organizations that might be anti your stance or anti your proposition. And so these are the things that you would also want to bring out of the science and the scientific literature to be like, well, actually, that's probably not the best way to go. In thinking about ways to write and put all this together, a policy memo is super, super important. And you want to think about who to focus that on, which is you want to really make sure that you are targeting the right policy and decision maker who has the power to move the needle. So when you're crafting your policy memo, you really want to focus that on persons who have the decision-making authority or who can put those motions into process. And so your policy memo will include, a basic kind of writing of here's what we did, here's what we found. You don't want to bring in everything, right? It's specific to your policy question. And then you want to bring in your ask. This is why I'm saying to you what we should do. Here's the scientific evidence of why it's important to act in this way, and so on and so forth. And as I mentioned, the economic argument becomes important. And also you want like a little paragraph that, like I mentioned before, that mitigates for against arguments. towards the policy that you want. And lastly, I think packaging all this together is really nice with infographics. So if you can really succinctly get this information across, policymakers and decision makers are often super swamped. They're getting information from everywhere. So can you develop a one-page infographic that just shows visually and represents visually the findings of your synthesis? That also goes a long way. And kind of delivering that together with your memo, with the infographic, with materials that be like, here's who I am, here's how you can contact me. All of that kind of lives together in your work with policymaking and your delivery of what you just synthesized to policymakers. So I hope that was useful, and I'm happy to answer questions. As folks engage in this work, we're always here, so please do reach out.
All right, and now that we've heard from Christopher, we're ready for our discussion and questions. So, Amy, if you want to go ahead and share the Padlet, and we can see if there have been any new questions that have popped up.
Yes, a couple of questions have popped up. So Laura, if you want to also help jump in, because I definitely think if both of us discuss. So some of these are from the last one, and I never actually typed an answer. So but someone did just ask, I think this one's a new one. Uh, is it necessary to use if this isn't a new question, I apologize. Someone said, is it necessary to use mesh for every systematic review, or is it more like a supplement? And mesh is the Medline medical subject headings, which is the controlled vocabulary that underlies PubMed and Medline, which there's a few other platforms that you can search Medline in. And I'd say in most health-related systematic reviews, you will want to use at least one Medline-related database. So I would say not necessary for every systematic review, but for a health-related topic, I would definitely recommend if you're using PubMed, Medline, I would recommend incorporating those mesh headings because each database has their own special vocabulary, and those mesh terms should be incorporated because that is like well, now I think they have some combination of people and computers assigning those mesh headings to each article that is indexed in Medline. So that way you can make sure that what you're, so for example, I guess one of my examples that I use all the time is if you type trauma, the word trauma into PubMed, the mesh heading for trauma means wounds, abrasions, like physical trauma. So you have to specify if you mean what type of trauma do you mean? Do you mean psychological trauma? Do you mean physical trauma? And by knowing how to find that mesh heading for that database or that controlled vocabulary, you can specify which type, which exact word you're meaning. Laura, do you have anything to add to that?
Yeah, to add to that, using the mesh terms or the controlled vocabulary for each of the databases really helps you focus in on the most relevant articles that you're looking for, as opposed to just finding anything that is labeled with those keywords. So it is highly recommended to use that. But one thing I do want to add is that there are a lot of public librarians throughout the country who have a certification in health information. So it might be worth going to your public library and asking for some assistance in using mesh. Not everyone is going to know how to use it, just people who have the specialization. But also give a call to a local university and see if they have the capacity to kind of help you go over the basics for this. Most librarians are more than happy to talk about controlled vocabularies all day, every day. So please take advantage of those resources.
And the National Library of Medicine, who adds and keeps the mesh vocabulary up to date. They also have a lot of webinars about mesh that might be more involved, but they're all on YouTube, so you can always kind of take a look through those and see if there's anything that you find helpful. Um, seeing saying so do the journals ask to submit the Cochrane data collection form if the manuscript is accepted for publication?
The answer to that is no, they don't need completed forms. It is good practice to go ahead and give them a copy of whatever form you did use. So people, if they try to replicate what you had done, have the exact same tools, but you don't have to have like a filled out copy that you submit to journals.
Yes,
That's a lot.
yes, and you don't necessarily have to use the Cochrane form if you
Yeah.
created your own custom form, just sharing that is, best practices for reproducibility and replicability. If anybody has any questions, you can also add them in the chat if you don't want to add them to the Padlet. And so, yeah, we can cover anything about evidence synthesis, not just about data extraction for today, because in the last two workshops, we were like right up on the end of time. So we made sure to leave a lot of space this time to kind of discuss even things that we didn't, you might have questions about from before, even if it's very basic. So feel free to ask anything in the chat, add anything to the Padlet that you're curious about. So I thought what Christopher said was really great and tied into a lot of what we said when we were talking very abstractly about data extraction, is that, while I know I'm the same way. I get excited when I'm reading research. I'm like, wow, these findings are so amazing. I want to mention everything that that I'm reading about, when I'm looking at an article. But you really want to think about what is the core of what I'm asking here, and that guides pretty much every step of the process. So I know sometimes people are like, well, there was this really interesting article that came up in one of the searches and it wasn't, it didn't match the inclusion and exclusion criteria. And I'm like, yeah, there's a lot of interesting articles, yeah, that don't that don't necessarily match your inclusion exclusion criteria, because you thought of that, in advance, and it didn't, uh, it's you thought of that in advance and you're asking a specific question in that particular article, although it was very interesting, did not relate to your specific question, or might have, it had one of the exclusion criteria, so it isn't included.
And while we're waiting for the questions to be typed on Padlet, I do just kind of want to expand on a few of them. The one I really want to expand on is how do I know whether our search strategy is right? We have some answers already on the Padlet, but one thing I want to make sure everyone knows is it's not really about getting the search strategy right. It's just about having a good search strategy. Are you finding the information that you would expect to find? If you are, then you have a good search strategy. If you aren't, you have a bad search strategy. So make sure you're actually finding that basic information. If you are trying to do a completely exhaustive search for this, make sure you contact somebody like a librarian who has experience with searching, that can help make sure that you're not missing anything. But if you're doing just the search for your policy memo, make sure that you're doing as well as you can with that. Don't worry about it being right. There is no right way to do it. And it's an art, not a science, is what we say.
Yes, and I always say, like, think back to English class when you were younger and think of synonyms. So as many synonyms as you can think of. So that, I mean, that's really kind of the name of the game, is uh thinking of all, for example, type 1 diabetes. You can type that any number of ways, and the mesh term is diabetes mellitus type 1, for example, but people don't necessarily say that when they talk to each other. And you could type out the number 1 or the Roman numeral 1 or the letters ONE. So just kind of thinking about things like that, even as simple as typing a letter a number with letters versus using the number, things like that. Yeah, I would say, um, don't lose the forest for the trees, but just think of as many synonyms as, we all have time constraints, so we can't think of every single word that in existence for something. But, looking at the background literature, seeing what words other studies are tending to use to describe a certain topic is very helpful, I think. Okay, I still see typing. Oh,
Yay.
there's something just popped up. Um, I'm trying to figure out which.
Oh, is there a specific total number to be included in systematic reviews? Um, There is never a specific number. It's always going to be what there is to answer your question. So, what question are you asking when you're working on this project? If you're asking a question about something that's relatively new, you're not going to have a lot of information because it takes a while time for research to be conducted and all of that kind of stuff. If you're talking about a more well-developed topic, something that's been researched for a long time, you're usually going to have a lot more resources. If you don't get exactly what you're looking for when you're going through a systematic review, that's when I would tell you to change the search strategy to see if that's maybe what's not working for you, because you do want to have articles that are actually answering your question. If they're kind of like on the periphery but not quite about it, it might be worth adjusting your question to see if you can get a little bit more on point. But Amy, do you have anything else to say about that?
Yes, I would say, yeah, it's similar to what you just said is if your topic is a very widely researched topic for many years, there will be a lot more information out there. I guess I'll throw out an example that I just used was diabetes. If your topic, you want to have your topic be narrow enough to where you can uh, have a manageable number of articles, but you can't just search for one big, like if you were like, I'm writing a systematic review about diabetes, that would be a lot, and that wouldn't really be, that's, you want to ask us, what do you want to know about this question? And that's where those question frameworks come in. So I say, try to be get as narrow as you possibly can to start, because you can always widen your topic a little bit when you're doing that background searching to figure out, okay, what exactly is our research question? Be as narrow as you possibly can, because um, medical research, public health research, it's always lots of articles are out there. I mean, some topics that are newer and less developed, there will be less information, and you can always make your topic more broad, is what I'm saying. So, asking questions like why, who, what, when, where, to get that question as narrow as you possibly can to start, and specific, so that, if you're not finding quite what you need, you can always expand the topic when you're working on that search.
And we do have one question on here that popped up in the first workshop, and I don't know that a lot of the names look familiar from the first workshop, so I'll go ahead and repeat it just because it's an interesting question. So what happens in the interim 17 years between research and translation into practice? So in our first workshop, we were talking about how long it takes for actual research to be implemented into practice. So the average here is about 17 years for translational science. So we have our research at the very beginning and we have our implementation or our practice at the very end of those 17 years. Bureaucracy is a lot of what happens in those 17 years. So when you're doing a research, you need to apply for a grant, you need to do the research, you need to write up the research, you need to publish the research in a journal. Usually other people need to build upon your research so they know that it's good. Then you have to get to scientists that are working within the industry or working within the government to actually make these changes. And that takes a very long time. For any of you that work in governmental organizations, I'm sure you know exactly what I mean, or even like in university systems. So don't be discouraged by the amount of time that things take. It's always going to take a long time when you're trying to implement a change. So that was just one thing that popped up in our first workshop that everyone seemed very interested in, and I wanted to reiterate that.
Yes, and somebody did ask the question, what is the relationship between evidence synthesis and implementation science, which um, I don't know the exact definition of implementation science, but evidence synthesis is looking at the research that's out there and, as we mentioned, examining it, having a specific research question, assessing it, gathering as all of the studies you can, and synthesizing that and assessing it for quality. So it's really asking what information is out there, how good of a quality information is that? And implementation science, I believe, is studying how science is implemented into. So I guess they're similar, but it's two separate. It's a very similar things, but just different. I hope my I don't know if that person is in this workshop, but I just wanted to uh say that. And someone also asked, I believe this is from the first uh first workshop, was how do you differentiate between your primary and secondary questions? Must the secondary support the first or be aligned with the answer of the first? Should we be referring to the same sources for both the primary and secondaries? What I usually tell people when you're saying primary and secondary questions, your primary question is the heart of the information that you're trying to find, so your main topic. And secondary is um, if if this information is included in a study, um, uh, we will be looking at that. But if a paper answers a primary question and might not have this secondary question, that's okay, right? Is there anything you want to add to that, Laura?
I don't know that I could actually explain it any better. It's a really hard concept for me to explain to people, so I'm going to steal what you just said. But yeah, pretty much your primary one is going to be what you have to find out of an article, and your secondary is like, this is really nice if it's there as well, but it's not the main topic of our paper or our research.
Yes. And sometimes people will word their primary question in a couple of different questions just because the wording, they don't necessarily, but yeah, I would just say secondary. It's like, it's nice if it's there. Um, and you'll talk about it if that information is there. And if it's not, that's something you can discuss. Like our secondary question was this, but we didn't find anything, kind of thing. So, um, does anybody have any more questions? I guess what I always like to stress is really the planning stages. I mean, just like if you're doing another type of research where you might have to submit ethics information to an IRB, even though it's all about you're looking at other literature and you're not looking at uh, it's not a randomized controlled trial or something where you're working directly with people. I always just say the planning of it is um, really is a step that should not be taken lightly, because if you plan well and you do the background research well, that will make the rest of the project go smoothly, because um, seeing what all is out there, and also just checking, has a systematic review been done on this topic, all of that kind of planning information, or figuring, kind of getting a sense of the literature that's out there that's as best as you can. Um, and writing that protocol and thinking through all of this stuff will set you up for success later on in the project.
Okay, and it does look like we have a couple people that are typing questions into the Padlet. And just a reminder that the Padlet will be available after the workshop as well. So if we don't get to answer your question here live today, we're going to be coming back in and we'll be answering the questions. So feel free to just go wild with them.
I'm glad you've enjoyed this workshop series, and when you can expect more such workshops. Not that is not known yet, or we're kind of ramping up the beginning of the fall semester, but we work with Tulane faculty quite a bit, and yeah, and if you really enjoyed it, I recommend filling out the survey to provide feedback and uh, reach out to Partners for Health Equity for advancing health equity.
Man, I think the next series is already planned, but I do not know what the topic is. So definitely follow P4HE if you're not following them on social media or signed up for their newsletters. It's a really great source of information.
Yay, Omar added the Eventbrite link to the other workshop. They do quite a variety of workshops. You know, we're talking about evidence synthesis here, but they have a lot of conversations about various things that affect public health practitioners and healthcare providers and lots of other things involved. So I really recommend just signing up for their mailing list, keeping track on their website, and just seeing what interests you.
Oh, are there any certificates provided for participating in the workshops? It'll be great to add about this in the CV. I don't know that there are any certificates for the workshop series. Um, Omar, do you know if there's any kind of plan for that?
There is no plan for that, but nonetheless, we can certainly provide any letter, official letter certifying if you need it for professional development or such. We can provide that kind of letter that would certify that you participated.
Thank you.
It's a great question.
Yes. Okay, we still have 2 minutes left. I see there is typing on the Padlet. And if you don't get the question out in 2 minutes, that's completely fine. Take your time typing, or add multiple questions.
And there is an end of workshop survey that was sent in the chat. I highly recommend filling that out, letting us know your thoughts. And thank you all for coming. We were super excited to teach this and really get this information out there for people that are on the ground working in public health and health policy and interested in learning more about how to incorporate evidence synthesis principles into writing for policy and recommending different policies to decision makers. And an email to was sent in the chat if you would like the letter of completion from Partners for Health Equity. All right, well, it's the end of our workshop time. We'll be checking the Padlet over the next few days, and I'll be responding to some of the stuff that we verbally responded to as well. So feel free to ask questions if you're still typing, or and we've been sending this out at the end of the workshops as well. Thank you all for coming, and have a wonderful rest of your afternoon.